have someone with me, and she's going to introduce herself and tell us a little bit about where I am, this beautiful location.
Thank you so much. Well, first of all, congratulations on your nomination.
Thank you.
And so, hello everybody. I go by Nurse Eunice, but my name is Eunice Mathis. I am a registered nurse, and I'm also an American Heart Association Training Center faculty member. So pretty much what that means is that I teach laypersons, I teach healthcare providers, but I also do train a trainer. So I teach those who train others and teach them how to save lives. So I'm very rewarding. I love what I do. And so thank you for saying that I'm the best, but all I do is I tell people I do three things. I teach people how to keep people healthy. I teach people how to save lives. And then I teach business owners how to prevent liability. So that's what I usually do. And so we're at Florida Training Academy. We're located in Jacksonville, Florida. Only open for the next generation.
Wow. Okay, can we jump in?
You can.
We're going to ask a few questions. So, how does CPR work? And, and what are some of the steps that people should really focus on? I think, of course, everyone should probably take the training and become certified.
Yes.
But for those who haven't had a chance to get certified, what are some important things we need to know?
So CPR stands for cardiopulmonary resuscitation. So cardio being the heart, pulmonary being the lungs, resuscitation, 2 skills, chest compressions and rescue breaths. And we'll get into whether or not you have to do rescue breaths given COVID and everything else. Mm-hmm. But so if someone's heart is in an irregular rhythm, it can stop contracting, it can stop circulating blood, which means there's no blood going to the vital organs. Right. And so when the heart starts to quiver, or if it stops, that means that time is of essence because there's no blood flow to the brain. So when you learn CPR, you are learning to help preserve someone's life until the paramedics can get to you, okay? Mm-hmm. And so it's really important to learn how to do high quality chest compressions. And so that's what we teach here. And so pretty much anybody, we have high schoolers. As a matter of fact, the governor mandated a few years ago, I think it was 2 years ago, that 9th and 11th graders had to learn CPR because we want the bystanders, the people in the general public, to learn how to do so, because most cardiac arrest events, they don't happen in the hospital where there's a nurse and a doctor. It happens at home.
Right.
And then one more thing I want to add to that is that right now, especially with the shortages in staffing, it used to be it may take about 5 to 10 minutes for an ambulance to get to you. I'm sorry, about 5 minutes for an ambulance to get to you. Now we're upwards of 7 to 10 minutes depending on where you're located. Right. So you knowing how to perform CPR could be the difference between you saving grandma's life or you just watching her as she, loses brain function.
What are some of the misconceptions that people have about CPR?
That women don't die from cardiac arrest, that you can't use an AED on a pregnant mother. Research has indicated that if a woman goes into cardiac arrest outside of a hospital, she's less likely to survive.
Will you say that for the camera again?
If a woman goes into cardiac arrest, if her heart stops and she's outside of a hospital, she's less likely to survive, especially if she's around men, because they're less likely, number one, to recognize that women even go into cardiac arrest. If you watch TV, you don't usually see a woman having cardiac symptoms because they don't want to show our exposed chest on TV. And so whenever you take a CPR class, it's rare that your mannequin has a feminine anatomy. Usually it's flat chest. And so we've given the public the perception that, hey, women don't have cardiac arrest events at the same rate as men. We do. We absolutely do.
And we are more likely to die from it.
Yes. So if you are someone who's an educator, health educator, if you have any connections with, a male who may be saying, well, if something were to happen, I wouldn't touch a woman's chest. Number one, you can perform CPR on top of clothing. If they have on a bulky jacket, you need to open up the jacket. You don't have to expose the chest immediately, but you do need to call 911. Start those high quality chest compressions if you recognize that the person isn't breathing, if they don't have a pulse, and that's going to help perfuse the brain, send some blood to the brain until the rescuers get there, or someone who's comfortable exposing the chest so we can actually apply that AED. So if you just don't do anything, you're just calling 911. It's like, hey, I don't want to touch her breast because she may sue me. I hope to negate that. I hope that, men would stop thinking that way because you've called 911 and the Good Samaritan law is going to protect you. And it's implied consent when you tap and you shout and you say, hey, are you okay? And if the person doesn't say, leave me alone, you have a right to render medical assistance within your scope of practice.
That's really a lot. because you said a lot, even on, I mean, because I watch a lot of like 911 and Chicago Rescue.
Yes.
You know, I watch these shows, and you're right. When I think back to it, I don't ever really recall an episode where a woman went into cardiac arrest. But they do.
We do.
We do.
At the same rates as men. We have the same stressors. We have diabetes. We have hypertension. We have a high stress lifestyle. And our symptoms are different. So if we do have a cardiovascular event, we're not going to have the doom and gloom elephant sitting on our chest, sweating. Oh, I need to go to the doctor. It's going to be grandma's tired and the back hurts.
Yeah.
And then she puts everybody before herself.
Yes.
So, you know, making sure that you actually go to your annual visits, that you get an EKG, just not before you have a surgery, but just like you schedule your mammograms, just on an annual basis, go ahead and schedule some lab work.
Hold on. Okay, I'm ready.
All right, so it's retraining the way that people think, because they've been taught ABC, airway, breathing, circulation. Airway, breathing, circulation. When there's an emergency, a medical emergency, you want to focus on the airway. That's only if your person still has a pulse. At the point where you're tapping and you're shouting, you're like, hey, are you okay? And you feel for a carotid pulse and there is none, you no longer focus on airway. You want to focus on CAB. That is circulation, airway, and breathing. Because
stop right there. ABC was the old is the old way, but now we are CAB.
CAB, exactly.
Okay.
And so a question that I ask a lot of our students in our courses is, if you're performing CPR on a victim who's in cardiac arrest and you are by yourself and the victim vomits, what do you do? I want you to think about circulation, airway, and breathing. Okay. A victim who's in cardiac arrest, their brain function is none right now. Right. You're performing the chest compressions to save their life. They vomit. Yeah, if you turn them to the side to clear out their airway, what happens to the blood flow to the brain?
It stops.
So your priority is not airway. We have to retrain the way that people have been taught, because for decades it was airway, airway, airway. Right. You focus on airway as long as the person still has a pulse. Once they're pulseless, you want to focus on those high quality chest compressions. So if you turn them to the side to clear out their airway, you prevent them from getting pneumonia, but what happened to their brain function? Wow. Now they're brain dead. Yeah. So I want you to focus on high quality CPR. When you call 911, those rescuers are going to come, and they can manage the airway. They can suction, they can do whatever else, but I need for you to keep circulating that blood. If you just have to do something, you have 10 seconds. Turn their head, sweep out their mouth, do not turn their whole body. Go back to your chest compressions.
Chest compression. Okay, I understand. CAB.
CAB.
I have it. Prayerfully, I never have to use it, but I do have it.
Our association notice also is that it's going to be easier to help those in communities that are the most at risk for cardiovascular disease if you have instructors who look like those people representing those communities. Yes. So, you know, when I say open the gates, I'm opening the gates to brown and black instructors also, because it's going to be hard for me to go into an Asian community or a Hispanic community, because now I have to use Google Translate in order to teach a CPR class. Wow. And I've been looking for a Spanish-speaking instructor here in Jacksonville, and I, haven't found one to partner with. But that would be a great way for us to go in. We do community classes. If I'm not able to go out and do it, we have a resource. We have the wealth of other instructors who will go out and provide CPR in the community. So who needs to know it? Everybody. Because if you are a new mom, you barely know how to take care of this baby, but now the baby's choking. Oh. What do? If you are taking care of your grandfather or your parent who's elderly and they have a diagnosis of congestive heart failure, and now you get home and they're having cardiovascular issues, what do you do? So I don't think it matters about the race as much as regardless, if you are a person who wants to help and you look after others, I think that you should know CPR. If someone needs assistance, I understand there may be fear. I need you to pause. Make sure the scene is safe. If the scene is safe, call 911 as you're approaching the scene, tap and shout, and then if you have that dispatcher on the phone, they're going to talk you through it. But actually getting hands-on practice, you can get practice without getting certified. And so we do a lot of knowledge only courses here at Florida Training Academy. What does that mean? It means that you can come and you can compress on the mannequins. We're going to teach you hand placement. We also are a provider of Narcan. And so we do Narcan training here, and you actually leave with your Narcan kits. And that's for somebody who may have overdosed on opioids. And so we do a lot of free training. We just need you to actually want it.
Very good. So someone's watching, I want to. Where do I start?
All right, so you can start by going to FL as in Florida, training.com. And there's also some other community resources like American Red Cross, but pretty much I don't care where you go. I just need for you to learn the skills. And your question could be, especially if you can't afford a certification, is where can I go to get a free training, just hands-on, because I have to take care of my grandfather and he has a cardiovascular, illness or a history, and I want to make sure that I can take care of him until the paramedics get there. And so there are so many instructors like myself, so many agencies. All right, so we're going to start off with a quick demonstration. First, we have to make sure that our scene is safe. If the scene is safe, you can approach. If it's not safe, I need for you to get to a safe location, call 911, and alert them to where the victim is. All right, so our scene is safe. We're going to check for responsiveness by tapping and shouting. Hey, are you okay? Are you okay? We don't just shout because the victim could be deaf. You want to actually try to stimulate them. All right, and so now that this person is not responding, you're either going to open up your cell phone and call 911. I still need for you to alert others. So, hey, you call 911 and come back. That's really important, because if you don't say that, you may be anticipating that your friend is calling 911, but if they're anxious, they may not do so. So, hey, you call 911 and come back and bring me an AED if there's one in the area. All right, so now when 911's on the phone, they're going to be asking, what's the emergency? You're going to be checking for chest rise and fall for no more than 10 seconds. If you're a healthcare provider, you'll be checking for a pulse and checking for chest rise and fall. But if you don't have any experience in feeling for pulses, just look for breathing. If the person is not breathing, you are to assume they're in cardiac arrest, and you can start your high quality chest compressions. So for 10 seconds, I'm going to look at the chest. There's no movement. I need to go ahead and start CPR. Your hand placement, don't compress on the throat. Don't compress on the very end of the breastbone, which is referred to as the xiphoid process. So remove any unnecessary clothing. You'd be on the floor, of course. Lock your elbows, press straight down. The goal is for you to compress 2 inches, or whatever the side view of their chest is, bring it in 1/3 of the way. You do 30 compressions followed by 2 breaths. And it'll go like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You now have 10 seconds to give your 2 breaths. If you have a facial shield, open it up, put it on the victim's face, squeeze the nostrils, tilt the chin, and give your breath. And do it again. And we're going to repeat. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths within 10 seconds. And you repeat that process until help arrives, until the person regains consciousness, or until you're exhausted. And so this is Nurse Eunice with Florida Training Academy. And if you need a hands-on CPR demonstration, I look forward to training you. And our website is fltraining.com.